The proteins in this one are high sensitivity troponin, well known to everyone. But what's interesting is that people often think of troponins as heart attack markers. But it turns out that even among individuals who do not have a myocardial infarction, troponin may be elevated and associated with the presence of underlying coronary disease in the absence of an MI, even in ambulatory asymptomatic individuals. So that's a very important observation. The second point, the second marker rather, once again, is KIM1. I mentioned it earlier. KIM1 associated with kidney disease, which itself is a risk for CAD, but also a risk for vascular inflammation. And lastly, adiponectin. Adiponectin is a really interesting biomarker. It's a what's known as an adipokine, which is a cytokine that's associated with adipose tissue, right? And this cytokine, adiponectin, is associated with the ability to break down glucose and management of fatty acids. So it's often abnormal in individuals with diabetes, but may be abnormal in folks without. And so when you combine these tests and clinical variables into a score, once again, we can appreciate the ability to both identify folks that have a very low risk for obstruction, and in this case, we selected an obstruction of 70% or greater, sort of very conventional, threshold for severe obstruction. However, I'll point out that across the scores that are generated, there's actually a linear association with the average coronary obstruction. So for those individuals that have a score of 4 or 5 considered high, they're up at the 70% or greater range. But folks with a score of 3 tend to have, on average, moderate coronary disease, and those with a score at 1 or 2 have much less obstruction, if not any at all. And so, again, advantages here, unlike a functional test like a stress test, or a calcium score, which both misses lipid-rich plaque and also doesn't tell you about the degree of obstruction. Depending on the score in the CAD-HS assay, you'll actually have a general framework for just how much athero may be present in your patient.